discussion board this week the purposes of completing a health assessment, preparing your patient, skills needed in order to complete a physical assessment, and the tools needed to get subjective information. So to start, why do we complete physical assessments? The big reason why we want to do physical assessments is to establish a baseline with our patients to determine whether or not they are getting better or worse with their care. Potential health concerns that they may have, or actual concerns, is another big one. So being able to recognize that maybe they are going through something medically that is negatively affecting their overall day-to-day life, and what can we do to help recognize and treat these concerns that our patients may bring to us. Another reason why we would complete a physical assessment is to support clinical decision making and interventions. Another thing that we want to do is to assess treatment effectiveness. So, is what we are doing for our patient working? Is it not working, and why? In order to prepare our patient, something that we would need to do, one is to gain consent, explain to them what we are doing, why we are doing it. So I read something in Hamlin et al. In the Journal of Nursing and Health Studies, is that sometimes whenever we are in and out of patient rooms, we tend to forget to adequately and effectively educate our patients in what we are doing and the interventions that we are performing on them. Another thing that we want to do is making sure that they feel comfortable, such as making sure that they feel comfortable with their nurse. So if you have a female patient and a male nurse, making sure that they are compatible enough in order to complete the physical assessment. So for that female patient, maybe she feels more comfortable explaining her medical situation with a female nurse, and then vice versa. Something else that we would need to do is to get a private area so that they feel comfortable again enough to explain to you what is going on. Making sure doors are shut, blinds are closed, and curtains are drawn are just another good way in order to prepare our patient. And then also making sure that they're adequately positioned. Are they supposed to be sitting for this assessment? Are they supposed to be laying back? Are they supposed to be prone or on their side or standing up? Preparing our patient more is than just telling them what you're doing, but also preparing them so that you can also carry out the interventions and skills needed in order to actively and appropriately get the subjective information to pass along. So also according to Hamlin et al. In the Journal of Nursing and Health Studies, they also described different communication styles and different skills that are required for the nurse to complete and have pretty good mastery of in order to accurately get information from our patients to establish a health assessment. First thing is doing psychomotor skills. Many of us have heard the IPPA for inspection, palpation, percussion, and auscultation. Being able to recognize when we're supposed to do each step and how we're supposed to do that in order to get such as belly sounds or GI sounds. Another thing that Hamlin described was accurate critical thinking skills, accurate communication styles, interpersonal skills, and also documentation skills. So you don't want to document somebody with rhonchi if they are having coarse bilateral wheezes. You also want to be able to say and recognize that maybe your patient is jaundice, being able to recognize that their skin color is changing, being able to recognize when their lung sounds are changing, and being able to also understand when you need to alert accurate data to your provider so that your patients can get better care. In our textbook, written by Jarvis and Eckhart, in the physical examination and health assessment textbook, they do describe very nicely in chapter 8 the different tools needed in order to complete a generalized health assessment. So, as far as what Jarvis and Eckhart described in Chapter 8, the different tools needed to complete a physical assessment, one of the first things on the list is a stethoscope. This allows me to listen to my patient for their lung sounds, heart sounds, belly sounds. I would put it in by making sure that the earpieces are pointing forward, and then using my diaphragm to accurately listen to lung sounds. And then I can also listen to heart sounds. And I would also listen in the back for accurate lung sounds if I was completing the respiratory assessment. Something else that I would need in order to complete my physical assessment is a blood pressure cuff. The way that I would put this on is by asking my patient to make sure that they didn't have any kind of fistula on one side, to make sure that I'm accurately putting the blood pressure cuff on the correct arm. So do you have any kind of fistula or anything I need to be aware of?
No.
No? So I would ask to see if I could see his arm. Align it so that the line meets with the arteries. Place it. I would make sure that the thing up here is closed off, and then I would also use my stethoscope in order to listen for his blood pressure, diaphragm on his brachial artery, and then pump until I can get an accurate blood pressure reading. Thank you. Once you see this, I'll take it off. Something else that I would need in order to complete a physical assessment is by using a watch with a second hand. So I would ask him, can I please see your wrist real quick? And I would count how many times his heart beats within 30 seconds, and then I'd multiply it by 2 to get an accurate reading of his pulse. So then in about 30 seconds, his resting heart rate is about 80, which is normal, within the normal defined limits. Something else that I would use in order to complete my head-to-toe assessment is a pen light so that I can see if his pupils are reactive, equal. So, may I please see your eyes? Since we're in a bright spot, I would actually cover one eye so that I can see his pupils properly. And then I would just kind of sweep in. I wouldn't just go right in, I would sweep in. And then I would do the exact same thing for the other eye. And they're both reactive. Another thing that I would use is a pen and paper. This helps me so that I can write down any kind of abnormals that I may find on his general health assessment, so that I'm not writing absolutely everything down, because then I'm taking too many notes about what's normal when I need to be writing down more of the abnormal values. Something else that I typically would also use is any kind of hand disinfectant before and after completing my health assessment, along with a pair of nitrile gloves, again to protect me from him and him from me. Granted, I know this person, but in the hospital or in a clinic, we don't know who we're coming in contact with, so being able to protect ourselves is very important. And one of the last few things that I would use to complete a health assessment is a thermometer. This one, you put it into the patient's ear. This helps us determine if our patient is febrile or afebrile. He is afebrile, so he is fine. So that is conclusion. Thank you.